A frequently asked question is, what should I have for dinner in diabetes? And if you say chapatis, how many chapatis can I have? Now you have to understand that diabetes is best treated by a relative degree of starvation. That means your body should never be fed to full. That's the reason why for North Indians whose staple diet is wheat, we say take rice, and for South Indians whose staple diet is rice, we say take any wheat products like roti or chapati. So a good idea is to replace your night meal with couple of chapatis. Now chapatis come in different diameters, so you should remember that it's not the question, but it is of number. You have to remember that it is not the question of how many chapatis you eat, but it is, approximately what size. So a medium sized chapati you can have 2, and you try to have lot of boiled vegetables or vegetable salads with that, and a portion of fruit as well. So try to avoid rice in the night and take a walk after your dinner. So 2 things: one, dinner, have couple of chapatis with vegetables or dal and maybe a bowl of fruit. Do not eat after 7:30 p.m. There are people who try to eat at 11 p.m. midnight, so come off that habit. Finish your dinner by 7:30 p.m. Go for a walk for about half an hour, come back. If you feel like drinking something, you may have maybe green tea or plain water. Don't take anything that contains cholesterol. Don't take anything that contains calories after 7:30 p.m. Similarly, when you get up in the morning, try to skip breakfast and try to have a combination of breakfast and lunch, what we call as brunch, around 11:30. So nothing before 11:30 a.m., nothing after 7:30 p.m. and evening meal you try to change it to couple of chapatis. You will be absolutely fine. Your sugars will be under good control, but it doesn't mean that you will come off medicines. Under medical supervision, make sure that you optimize your medications to get your fasting blood sugar to 110 milligrams per deciliter. Your fasting blood sugar should not be more than 126 anyway. Your post-lunch blood sugar should be in the region of about 160 milligrams per deciliter. Every 3 months, get your HbA1c checked, and it should be less than 7%. So with these dietary modifications, if you are able to get these targets, you will be absolutely fine. Do not stop medicines under any circumstances unless you have been asked to do that by doctors. Do not change your medications. Don't treat yourself. Go to a doctor, follow the instructions, follow the dietary guidelines, engage in regular exercise. Don't take anything which contains too much of cholesterol. Avoid smoking, alcohol and non-vegetarian foods. That is the way to prevent diabetes complications. Have a great life.